and I am your sports physio. Today we are going to discuss the most innocent joint of our body. Can you guess which one that is? That's our knee joint, right here. Many of us have experienced some stress, strain, aches or pain, and sometimes even stiffness around the knee. For example, when you're running up and down the stairs, or for the ladies, after a long day when you take off your heels. Many of us have a habit of sitting cross-legged, and as soon as we uncross our legs and try to get up, we don't feel so comfortable. A lot of times, when you try to suddenly run or suddenly do something, and then you experience some niggle or stiffness in the knee. Runners, they feel pain right here at the IT band connecting the knee and the hip. Footballers, they get injured in the knee. They injure one of the ligaments called as the ACL ligament right here in the knee. And sometimes they even have to go for surgery for the same thing. A lot of us have loose knees. They tend to wobble and we don't feel so stable while walking. Now, why does all of this happen? And mainly, how can we prevent this and take better care of our knees and run, jump and do whatever we want to do? I will give you 3 tips as to how you can take care of your knee. Before that, let's understand what the knee does. So our knee essentially is a hinge joint, just like a door which opens and closes. It is sandwiched between 2 major joints. One is your hip, which moves round and round, back and forth, inwards, outwards, and your ankle, which you can rotate up and down, and your ankle and your feet make those tiny adjustments while you're walking on the road. What a lot of us don't realize is that our hip has this major muscle, your buttock muscle, the glutes, which control your knee joint. So our body weight is centered around the center of our body, and our body tends to collapse inwards towards that weight. The muscles, our shoulder muscles, our hip, glute muscles, which are really strong, keep us straight and tall. A lot of us don't use our glutes enough. So the first exercise for you is buttock squeeze or glute squeeze. You can do this everywhere, even when you're standing, talking with your friends, sometimes even when you're sitting. So all you have to do is, I'll show you from the side. Stand tall, straight, and see to it that you squeeze your glutes. Hold them for 5 seconds and relax. Again, squeeze your glutes. Hold 5, 4, 3, 2, 1 and relax. Now, what does that do? For that, you have to concentrate on my knees. So, right now I am not squeezing my glutes. Now, as soon as I squeeze my glutes, you will see my knees rotate outwards. So, again, squeeze and they rotate outwards. So, our glutes essentially stop our knees from falling in. Now, which is the second thing? The second thing obviously is the ankle. Our ankle and feet make many tiny adjustments when you're walking on uneven surfaces, especially our roads. And that's why many of us, when we're walking and we're not paying attention, we tend to sprain our ankle and sometimes even sprain our knees. That's where your wobbly knees come from. How can we strengthen and increase the balance and proprioception of our ankles so that they can support the knee better? For that, the second exercise that you have to do is very simple. Balance on one leg with your eyes open. And when you're balancing, you tend to notice that your feet or your knee tends to roll in like this. So all you have to try and do is push your weight on the outside. The idea is to stand like this for 2 minutes. Now, when you're walking on road, you're not really thinking of the balance. You're not really thinking of what our ankles or our feet or our knees are doing. And that's why balancing with eyes closed is more important. So, again, stand on one leg. You want to close your eyes and try to maintain this balance for at least 2 minutes. Now, while you're doing this, a lot of people will tend to lose balance inwards, outwards. At that time, simply you have to put the other foot down, regain your balance, close your eyes and again start. So when you get to a point of 2 minutes with eyes closed, that time your ankle, your knee, your hip has activated all those proprioceptors, all the balance receptors to allow you to function, move more efficiently without really injuring your ankle or the knee. Now the third thing is, while we are walking, a lot of us tend to put weight on the inside of the feet. So if you have to look at my feet, ankles keep on falling inwards all the time. So here, what you have to do is roll the ankle outward, keeping the toe on the floor. So try and push your weight to the outside and lift your arch up. And hold for 5 seconds, 10 seconds. So this is the third exercise, which is the arch exercise. And you can do it everywhere and anywhere, even inside shoes. So when you're sitting at your desk or when you're walking, not recommended to begin with. Start by sitting at your desk or when you're standing, and slowly and steadily you can adapt it to walking too. So all these things together, the hip squeeze, which controls the knee, your ankles, which also allow the knee to stay in position, will help your knee become stronger and better as you keep on moving and avoid all those aches, niggles and injuries. Next, I'm going to come up with exercises to strengthen the posterior chain, which will strengthen your hip, knee and ankle, all of them together. So, till then, do these 3 exercises, feel your knees get stronger and you able to move more efficiently, run up and down the stairs, jump, hop, skip, everything. So, till then, stay healthy, stay fit, stay strong and do all these exercises. See you guys.